Hello and welcome to this presentation. The topic of the presentation is integrating data in mixed methods research. My name is Cheryl Hunter and I'm a research officer at the University of Oxford in the UK. And this presentation was recorded as part of a mixed methods forum at the University of Oxford on the 29th of April 2014. To give a context to the talk, the following talk was prepared as a journal club presentation discussing integration in two mixed methods papers. So the format of the presentation is more to do with critiquing the papers than actually presenting an overview of how to integrate in mixed methods research. The Euclidean paper, which is the first one we draw on, actually outlines three different methods of integration and will be of most interest to those who are looking for practical solutions as to how to integrate in a mixed method study. The two other papers, Sampson et al. 2010 and Adamson et al. 2009, both use different forms of integration in a mixed method study, and therefore they will be of most use to people who are interested in seeing how integration works in practice. So the first paper by Euclidean et al., who's based in Sheffield in the UK, presents three different techniques for integrating data, and in the main presentation I'll go through those different techniques and introduce them. You should be able to find this open access on the British Medical Journal website using the information on this page, but if you can't access this or any of the other articles, it's always worth emailing the first author to ask if they have a copy they can share with you. The second paper, the Sampson et al. 2010, is a mixed method study looking at a primary angioplasty service and whether it could replace routine care of thrombolysis. The second study, which presents a form of integration in a mixed method study, is Adamson et al., and this explores the impact of patient views on appropriate use of services and help seeking, and it uses a different form of integration to the Sampson et al. Paper. Here are all the references that I actually refer to during the main body of the talk, and you can use these to find them if you want to follow up on anything that's mentioned. I hope you enjoyed the talk. Thank you very much for listening.
Okay, so the aim of my talk is, well, partly to be brief, but I'm just going to run through the papers, the Euclidean paper, the Sampson paper and the Adamson paper, and talk about the integration as they describe it, and then propose some questions for us to maybe discuss in more detail. So this gives you a little overview of what I'm going to talk about. It's a little bit difficult to see, but just going to talk about defining integration as it's as Euclidean et al. Write about it, but also a little bit about Moore and Ellis et al.'s definition, and then reasons why you might think about integrating rather than doing something else. And then go through the three methods that Euclidean et al. Propose that they found in the previous health services literature, and then talk about Sampson et al., Adamson et al., and then come to some questions that occurred to me. Okay, so definitions of integration vary, like as we talked about last time, mixed methods definitions varies, so does the term integration. And you'll find a great deal of variation around the terminology used as well. Some people talk about triangulation, some people talk about combination, some people talk about integration. But I quite like the way that Moore and Ellis et al. Talk about integration and triangulation. They suggest that integration is more of the particular practical relationship between different methods, different data sets, different analyses, and different findings. And they then separate triangulation to be a particular epistemological way of looking at mixed methods. So they propose two different types of triangulation, one which is about trying to use one method to offset the problems with another method. So the idea is that you're increasing the validity of your study by triangulating, and that comes from more of a realist perspective. And then the other aspect of triangulation they talk about is to do with complementarity. So I think the methods we're talking about today in the Euclidean paper, the way she describes integration, that's along the lines of complementarity. The aim is to use different methods to complement each other and give you different perspectives on the same phenomenon, and bring them together to create a more complete whole idea of what's going on. Okay, so in the Euclidean study, they talk about integration as an interaction or conversation between qualitative and quantitative components. And I thought actually that's quite a nice definition, because it gives you this openness about what the interaction and the conversation might look like and at what levels that interaction might occur. Will it occur at the method level, the data level, the findings, interpretation level? And it also suggests that they affect each other. And quite often in mixed method studies, you see that one affects the other, and then that basically one of them, as Manisha talked about the last time, one of them will be dominant and the other one will be subordinate. So you'll have qualitative methods informing a quantitative study, but the main thrust behind the study will be quantitative. Whereas this idea of integration is about both methods being as equal as possible, both are being used to come together and give you a better idea of the phenomenon. And as they say, they describe it as pragmatist in terms of its epistemology. It's what works for the question that you have in mind. Okay, so just to kind of reiterate some of the stuff to do with the rationale for integration, the idea of the mixed methods unique selling point is that it should combine methods to achieve breadth, depth and multiple perspectives on a topic. And I like McDowell and McLean because they talk about the ideas in health research as we're interested in both the experience and the scope of most of the issues that we're looking at. We want to know who it affects as well as how it affects them. So actually mixed methods is a really natural fit for health services research or health research in general. And the argument that Catherine puts forward for integration is that it should have this idea of achieving a whole greater than the sum of its parts. And they do talk about this balancing of strengths and limitations, but it's more that you're looking at a different aspect of the question that can't be answered with one method, so you try and answer it with another, rather than kind of shoring up one method with the other. But she does talk about how difficult integration is in practice, and that might be one of the reasons why it often doesn't occur, that it requires a lot of time, effort, expertise, and thinking about the concepts and the purposes of the different methods. And she talks a lot in the Catherine paper, they talk a lot about the team working aspect, that actually it might be easier doing mixed methods research sometimes with one researcher because that offers continuity between the different methods and what you're trying to achieve, whereas what often happens is it's done in large teams, which makes sense because you're doing more research, but then one team might dominate the other, or a particular PI drives the research in a particular direction. So they're actually not given that kind of equal weighting in the analysis and the interpretation and the write-up. Okay, so the Euclidean methods for integration, as you will have seen in the paper, the first one they talk about is triangulation protocol, and this is the aspect of triangulation which is about complementarity. It's about creating a more complete view of a question then, rather than corroborating with one method with another. And then they talk about following a thread, which is more about going back and forth between methods, asking questions with one method and then trying to answer it with the other, and actually that interplay between the different types of data. So with triangulation, they talk more about the integration happening at the interpretation level, whereas following a thread happens more at the analysis level. So you're doing different types of analysis, but they're both informing the other. And then the mixed methods matrix is kind of similar to doing a case study analysis, which a lot of people will have experience of, where you're actually using your cases in a matrix. So you'll have 1, 2, 3, 4, 5 cases, and that case could be an individual or an organization, whatever. And then the sources of the data are all across in columns for each case. So you look at different types of data, but you're looking at them at a theme level rather than looking at them from answering one particular question level. So the object of the analysis is a case rather than any particular theme. Okay, so that's the diagram that Euclidean et al. Proposed to show how these different methods of integration look when you're thinking about where they happen in the data in the research process. Okay, so because I wasn't going to talk about a formal method of triangulation protocol because they said that they don't have any examples in the literature, I just summarised here what a triangulation protocol would be aiming to do, and I've already sort of mentioned some of this. So it would be aiming to examine meta-themes across findings from the different components of research. You'd be producing some kind of convergence coding matrix. So you'd be looking for ways in which the data agree, ways they disagree. You might be looking for where one method talks to a particular theme and the other one doesn't, and why that might be. You'd look at whether it's an artifact of the method itself, or whether it's just something about that theme that could only be accessed with the quantitative method rather than the qualitative, and vice versa. And then you're also looking for partial agreement and dissonance. So basically you're testing each one of the themes against this idea of, is it in the qualitative data, is it in the quantitative data, and if so, how do they interrelate? Do they look the same? Are they saying different things, and what does that mean? So it's really, again, it's about trying to treat each set of findings equally and looking at how method affects the interpretations you can produce. Okay, so Sampson et al. Was the paper that looked most closely like a triangulation protocol. They assessed the feasibility of a primary angioplasty service, and they were interested in the concept of satisfaction. So they wanted to look at satisfaction in patients and carers with usual care or with the new angioplasty-based care. And they did this with 3 different phases. They used interviews to determine what factors influence satisfaction with care, so they could produce a questionnaire based on that. Then they used the questionnaire to determine the levels of satisfaction in patients and carers on those factors, and establish any differences in satisfaction across those services. And in phase 3, they also did interviews to determine what those differences of satisfaction meant. So they took some people who did the questionnaire and stratified them based on how satisfied they were, how dissatisfied they were, and different other features that they thought might be important. And then they asked them, well, what's going on here, to try and figure out what those differences in the surveys meant. I won't go into the findings, but the 2 key things was that there were high levels of satisfaction across both services, but the qualitative interviews really helped them get to what that satisfaction might mean in terms of the feasibility of a service. So one of their key findings was the carer satisfaction. Carers seem to have a lower satisfaction in general with both types of intervention, but the inconvenience was the inconvenience that carers said they felt when they were going to these sites was considered reasonable given the nature of the treatment. So actually they decided in the end that the primary angioplasty service would be reasonable. The kind of integration that they showed in this study, I mean, this is my interpretation of what they did as well as what they say they did. They had an iterative process so that actually each phase fed into the next phase. So that's more similar to kind of a combination type study where you're using an interview to guide a questionnaire and then you use the questionnaire to guide interviews. But because they had that kind of balanced approach where each set of data informed the next, it seems to be more integrated than some of the other studies might be. And they used this concept of satisfaction and they looked at it in terms of the scope and the meaning. So they actually did what McDowell and McLean say that mixed methods should be doing. They looked at one concept from multiple perspectives. They did the integration after the analysis. There was an idea of integration at a methods level where they actually did things like when stratified their interviews by high and low satisfaction, so it was quite strategic to offer another perspective on the questionnaire data. And they argue that what the integration did was it allowed a more complete understanding and enabled a confidence that they could attribute the findings to the service, which they might not have been able to do had they just done questionnaires alone. And I'd argue that in a way the quantitative survey became less relevant in this study because of such high levels of satisfaction. That data didn't seem to be as helpful as it could have been, and they needed the qualitative interviews to actually show them a finding that helped them with the service. But there is a sense here of the pragmatism because health services research would need to know the scope of satisfaction across their service. They would be interested in those numbers, even if they didn't say as much as they would like. Adamson's study, this one was more along the lines of the following a thread method of integration. They aim to understand patients' views on appropriate use of services and whether these attitudes influence help-seeking behaviour. So they were interested in both people's reporting of using health services, but also their views on what's appropriate and what's not appropriate, and to try and understand the link between the two. They did a questionnaire survey and follow-up questionnaire interviews with a purposive sample of people from that questionnaire survey, but they kind of did them both at the same time. So they took a subset from the questionnaire survey and interviewed them. And one of the most innovative things that they did was they used the exact same questions in the questionnaire and the interview, and they call it a questerview, which I hadn't heard of before, which I don't know what people will think of that method, but it meant that they had this complementarity of the questions being asked across methods. And again, just really briefly on their findings, some of the interesting things were that they only presented part of the questionnaire findings in this study. They actually published the rest of them separately in a straightforward questionnaire demographics kind of paper. So that seemed to suggest that whilst there was some integration in the study, some of the data was actually treated separately and given, and the questionnaire, the survey, quantitative data was actually privileged on its own. They found that over half of people believed that other people use services inappropriately, which I'm not sure would now be much of a surprise to people, but there was this idea that people justified in their own minds why they use services, but thought that others must be using it inappropriately. And they did their research using vignettes in the questionnaire, so actually they presented people with symptoms, asked them to rate them, and whether they think they should use the service based on what the symptoms said. And they found no association between people thinking that services are used inappropriately and people suggesting that actually in the vignette this person should use services. So this is where the integration really came in, because the Adamson they went back to the questionnaire data and used hypotheses that they generated from the qualitative interviews, such as anxiety being maybe a factor that might influence people's questionnaire answers, and then tested that against the questionnaire data. So that's the idea of following a thread, is you use the analysis from one of the methods to generate questions for the other method and then answer it with the other method, and vice versa. Okay, so their integration, it's an iterative process. They go back and forth and think about one through the other. They use these methods that seem to be very complementary, and they generate hypotheses from one to the other. I think the symmetry of methods with the questions seems to have facilitated their ability to do this, but at the same time, they don't give a lot of detail about how they did those interviews using the questionnaire. It would be interesting had they done a bit more of reflection on the different methods and how they produce different kinds of answers because of an artifact of method. And at the end, I mean, I just thought, because they use vignettes, I think they try and use vignettes in a sense because they allow people a bit of distance from reporting on their own behaviours, which of course can be quite problematic, and they're trying to access people's kind of public views on the issue of service use. But the use of hypothetical situations does mean that the nature of the conclusions is slightly different. All we can really say is people report that they think others are using services inappropriately. It doesn't, and they think that in hypothetical situations people should seek help, but that doesn't tell us how they might seek help in the real settings themselves. So just a very brief summary of the two papers. In terms of the integration, they use methods that are already in quantitative or qualitative research. They quantize qualitative data, they use vignettes, they use open-ended questions from the survey and give them a qualitative analysis. They generate hypotheses and testing. So actually they're not doing anything particularly new, they're just combining them together in the one study to the one question. I mean, what I thought was most interesting about both papers is that they're talking about attitudes and context. They're not talking about kind of demographic information, they're not talking about experiences particularly. They're interested in the attitudes people are professing, how that influences what they think they might do, and how that might influence service provision. And these attitudinal studies, I thought, might work better with mixed methods because the concepts are subjective, that's partly written into how they think about the concepts, whereas there may be other types of data that we don't think would mesh as well in both types of method. And again, that's open for a discussion, what people think of that. And then I just I thought about what really occurred to me during the different papers. I kept coming back to this idea of, did they create a whole greater than the sum of its part in each of the papers? My personal feeling is that it was really nice to see people thinking about both sets of data together, but at the same time, the findings from both studies weren't particularly unique or shocking or different to things that I've seen in other papers that have only done one method rather than the other. So it's worth thinking about that. Did they actually achieve their goal of creating something greater than the sum of the parts? I wondered about, maybe we can talk about what combining methods really does, what do you lose from doing that, what do you gain, and is it okay to do what Adamson did and present part of your results in a paper separately, which is purely quantitative, and then have a mixed paper on the side? Is that something that really sits well with the idea of what they're meant to be doing with integration? And I guess something that didn't come up a lot in these papers but was interesting was how they resolve tensions that arise when the two methods don't agree. They didn't really talk about that within their papers, but then they're presenting a snapshot of part of the studies that they did. I thought it might be interesting if we talk about other ways people think integration might work, and about this aspect of team working. Like, does anybody have experience of what Catherine are talking about in terms of how you negotiate giving both sets of data equal weight when you're working within a team and you're working towards particular grant questions? But that was everything I was going to say, and then the floor is open for people to ask questions or give comments or just have a more general discussion. So thank you very much.